We are all in the challenges now. We are all aware what is happening with the financial crisis, geopolitical crisis which we have, climate change, antimicrobial resistance, universal health coverage, and local production of medicines and diagnostic within our continent. But our approach is WHO Afro now in Brazzaville with all the 47 member states. One, I think all of us have decided, if you look on my manifesto, the vision is to have a healthier, more resilient healthcare system because COVID taught us a lot. So what our approach will be, we are 47 member states. The priorities of Ethiopia can be quite different from priorities of Seychelles, or the challenges in Seychelles can be very different from the challenges of Gambia. So what we are approaching our member states country, which are 47, through our WHO country representative, is what are the priorities of the countries. Once we know priorities of Ethiopia is on primary health care, let's say domestic financial financing, health financing. So we tie those ones with the regional, which is Afro, and try to align them with the global. So with that alignment, I think end of the day, we are going to achieve the goal of Africa to be independent with its running of health. It concerns our population. So we need, when we talk of sovereignty, health sovereignty, we are talking about the countries taking responsibility of the health of their population. How can we do this? The key issue is to invest on primary health care. I don't say we should forget about the tertiary, but we are all aware. If you look on outbreaks starts in the community and they end up at the community. So if we invest on primary health care, investing on community health workers who live in the neighborhood with the population, who are closer to the population, teach them the basics. I think that should be the goal to. The second thing is on domestic financing. We have to come up with innovative domestic financing, right from sin taxation on tobaccos, alcohol, still debate on the sugary products. We have to look on involving the private sector because it's very crucial, involving the philanthropist, civil rights societies, communities, together with our countries now. We are talking with the ministers. We have to look on our health budgets. They have to increase according with the priorities of the countries. I'm just coming from Ghana, where we had a summit on Accra Compact, Sustain Initiative, sovereignty on health financing. The direction is to make us more independent. It's our problem, we have to own it. And I believe if we work collectively, we should achieve it, because let me jump a little bit. When you talk of local production of medicines and diagnostics, currently we are buying over 80% of the medicines and the products outside the continent. It means we have the capital. It's just that we need the planning now. Member states have to sit down and now do the need assessments, because that's where the planning starts. Because it concerns me if we don't pass information between our member states. What about one day we find half of us are all producing paracetamol? Then whom are we going to sell to? So I think the needs assessment to see what our essential drugs we want to start, or what our essential vaccines we want to start is, which country is producing, at the same time to go parallel with our regulatory system. Because with the regulatory system, as a continent, there are two ways to look at it. Do you want to look at it as the best or the good for our continent? So we is an area which we as a continent, should we come up with our own criteria? If you meet this criteria, you have passed for the production. It's something which honorable ministers and other sectors which are involved, we need to pay attention on it. We need to discuss about it. And if you ask me personal, we have to come up with our own regulatory criteria to meet it. And of course, the starting point should be the transfer of skills from the north to south. And this is, if you look on details, is the whole area of the pandemic accord which was signed recently. Transfer of technology, accessibility of vaccines, not your purchasing power, but if the need is there, you should receive them. Because end of the day is quality and equitable access to the basic health care.